Health officials fear many people may have been exposed to Mali's first Ebola victim, a 2-year-old girl. She recently arrived from Guinea, one of the worst affected countries, and has since died. The girl showed symptoms, including a bleeding nose, while traveling on a public bus through several towns, the World Health Organization, WHO, said. 43 people, including 10 health workers, who came into contact with her have been identified and isolated. The girl was being treated in the western town of Kayes, after arriving at a hospital on Wednesday. The child had traveled more than 1,000 kilometers, 600 miles, from Guinea through the capital, Bamako, to Kayes. The child's symptomatic state during the bus journey is especially concerning, as it presented multiple opportunities for exposures, including high-risk exposures, involving many people, the WHO said. The girl's mother died in Guinea a few weeks ago and the child was then brought by relatives to Mali. Guinea, Liberia and Sierra Leone have seen most of the 4,800 Ebola deaths. People are afraid in Mali's capital, Bamako, but life is carrying on as normal. A few people have stopped shaking hands, but physically greeting people is an important part of life in Mali, and for most this has not changed. Some hotels have placed bottles of antibacterial gels at their entrances, but for ordinary Malians, gel remains too expensive. The government has been running public information broadcasts telling people to wash their hands with soap. But though soap is not expensive, most still wash their hands with water alone. Many Malians have friends and family in Guinea, and several buses and taxis travel between the two countries each day. With the support of the WHO, Mali's health system has been preparing for an outbreak of Ebola for several months. But there is a culture here of visiting people when they are sick to wish them a speedy recovery. This will have to change if Ebola becomes more widespread. Mali has now become the 6th West African country to be affected by the outbreak, although Senegal and Nigeria have since been declared virus-free by the WHO. The WHO has 3 experts in Mali evaluating its ability to cope with Ebola and will send at least 4 more over the next few days, spokeswoman Fadla Chabe said. With porous borders, countries neighboring Guinea, Sierra Leone and Liberia are on high alert for possible imported cases of the virus, says BBC Africa health correspondent Ansoy. Vaccine boost. The World Health Organization, WHO, has meanwhile announced that hundreds of thousands of vaccine doses should be available in the first half of 2015. WHO Assistant Director Dr. Marie-Paul Kenny told a news conference in Geneva that 5 more vaccines would be in the clinical trial stage in January. 2 are already being tested on humans. The pharmaceutical companies developing these vaccines, as well as the ones which are a little bit further along the development path, are committing to ramping up the production capacity to millions of doses to be available in 2015, with hundreds of thousands ready in the first half of next year, she said. Vaccine trials in the worst affected countries could begin in December, Dr. Kenny said. U.S. nurses. In the U.S., 2 nurses infected with Ebola while caring for dying Dallas patient Thomas Duncan have been declared free of the virus. One of them, Nina Pham, 26, had a meeting with President Barack Obama at the White House, hours after being discharged. "I feel fortunate and blessed to be standing here today," she said. "I am on my way back to recovery." The other nurse, Amber Vinson, has also been declared virus-free, but she will remain in treatment in Atlanta until further notice. Thomas Duncan died earlier this month, and it is still unclear how the nurses contracted the virus while wearing protective clothing. The news of the 2 nurses' recoveries comes a day after a new U.S. infection, the first in New York. Craig Spencer, 33, began to feel tired on Tuesday and developed a fever and diarrhea on Thursday. He had recently returned from Guinea, where he had been working for medical charity, Médecins Sans Frontières. Dr. Spencer is being kept in isolation at New York's Bellevue Hospital. Ebola virus disease, EVD. Symptoms include high fever, bleeding and central nervous system damage. Spread by body fluids, such as blood and saliva. Fatality rate can reach 90%, but current outbreak has mortality rate of about 70%. No proven vaccine or cure. Fruit bats, a delicacy for some West Africans, are considered to be virus's natural host.